an abscess. That is usually a bacterium which has caused an infection and then the accumulation of pus. And these are dead white blood cells and digestive tissue, and also dead and living bacteria. And it can be oftentimes through Staphylococcus, it can be through fungals, and it can be also amoebias by liver abscesses. It can be at the armpits, the breasts, the groin, the gum, liver, brain. And if at the skin, we can have redness and swelling, and some are hurting, others not. And there are antibiotics and antifungal injections and hemoptysis, and they can cause so much damage that they can injure an internal organ and then cause death even. And they are reaching the skin through bone and through the bloodstream and an internal organ. And they can be surgically drained. Sometimes they are bursting and draining spontaneously, and after draining there can be permanently a tube in it to drain it continuously. And that is according to the Illustrated Medical Dictionary book by Sue Davidson, Penny Press, and Francis Williams on the pages 5 and 6. But this is no substitute for medical knowledge and also medical advice. Hi and welcome. I'm trying to learn medicine. Today, abscess, and after I've done it, we're going to do squat training. And if you participate in the squat training, then it's at your own risk. And we're talking about internal anatomy, and stuff like that. And this is no medical advice, I'm just trying to read and to understand it. Abscess, a collection of pus formed as a result of infection by microorganisms, usually bacteria. So the abscess itself is the accumulation, the collection of the pus, which is formed as a result of an infection by microorganisms, which are usually bacteria. Let's take one look at pus. So we're going to talk about stuff like that all the time. A pale yellow or green creamy fluid found at the site of bacterial infection. Pus is composed of millions of dead white blood cells, partly digested tissue, dead and living bacteria, and other substances. A collection of pus within solid tissue is called an abscess. So it is millions of dead white blood cells, partly digested tissue, and dead and living bacteria. It could be other substances. So dead white blood cells, digested tissue, and the bacteria, and dead and living bacteria. Abscesses may develop in any organ and in the soft tissues beneath the skin in any area. So in any organ and in the soft tissues beneath the skin in any area. Common sites include the armpit, breast, see breast abscess, groin, and gums. See abscess dental. Rarer sites include the liver, see liver abscess, and the brain, see brain abscess. Common bacteria such as Staphylococcus are the usual case of abscesses, although fungal infections can cause them, and amoeba are an important cause of liver abscesses. Infectious organisms usually reach internal organs via the bloodstream, or they penetrate tissue under the skin through bone. So they can reach the internal organs through the bloodstream, or they can enter through bone in the skin. An abscess may cause pain depending on where it occurs. Let's go back for a moment. Staphylococcus. I don't think we have an entry. Staphylococcal infections. Infections caused by bacteria of the genus Staphylococcus. Different types of staphylococci are responsible for a variety of disorders, including skin infections such as pustules, boils, and abscesses, and a rash in newborn babies. See necrolysis, toxic epidermal pneumonia, toxic shock syndrome in menstruating women, urinary tract infection, food poisoning, and, if a bacteria enter the circulation, septic shock, infectious arthritis, osteomyelitis, or bacterial endocarditis. Okay, wer will Streptococcus? Staphylo. Where are you? Stapes? Starch? Whatever, I can't find it. Okay, common bacteria, such as staphylococci, are the usual cause of abscesses. So staphylococci bacteria are usual, but it can be also fungal infections. And amoeba, I think we did this once in medicine at some point. Amoebiasis, amoeba, a type of protozoan. An amoeba is a microscopic single-cell organism with an irregular, changeable shape. Amoeba live in moist environments such as fresh water and soil. Some types of amoeba are parasites of humans, causing diseases such as amoebiasis. We did amoebiasis. An infection caused by the amoeba and Amoeba histolytica, a tiny single-celled parasite that lives in the human large intestine. Amoebiasis is spread through drinking water, eating food contaminated by human excreta containing cysts of the amoeba. So staphylococci and fungal infections It can be amoeba by liver abscesses, for example, reaching up through the bloodstream internal organs, penetrate through wound the skin. It can cause pain depending on where it occurs. Most larger abscesses cause fever, sweating, and malaise, whatever it is. They can cause fever, sweating, and malaise. Those that are close to the skin often cause obvious redness and swelling. Redness and swelling when at the skin. Antibiotics, antifungal drugs, and amoebiotics are usually prescribed as appropriate. So antibiotics and antifungal drugs and amoebicides are usually prescribed as appropriate. Most abscesses also need to be drained. See surgical drain, and in some cases a tube may be left in place to allow continuous drainage. Some abscesses burst and drain spontaneously. Occasionally, an abscess within a vital organ damages enough surrounding tissue to cause permanent loss of normal function or even death. Okay, I think we have it all. Am I able to save it now? An abscess is a collection of pus, usually which is the result of infection by microorganisms, usually bacteria. Can develop in the skin, then through the skin penetrated through a wound, or also through the bloodstream reached the internal organs. We could say common areas: armpit, breast, groin, gum. Could be also liver and brain. Staphylococci and fungal infections, and also amoeba, for example, can cause it, amoeba liver. And when they can cause pain if they enter the skin, or they can cause pain, and they can cause fever, sweating, and malaise. And the skin redness and swelling. There exist antibiotics, antifungal drugs, and amoebicides. And sometimes they are surgically drained, sometimes even a tube stays there to allow continuous drainage. Some are bursting and draining spontaneously. They can be at a vital organ, and then it can happen with the damage so much of a vital organ, which will cause loss of function and death or death. Okay, I'm going to stop thinking. Prostate, white blood cells, bacteria, and digestive tissue. Let's start it and look for what we have to go back. An abscess, that is the collecting place of the accumulation of pus caused usually through a bacterium which has caused an infection. Or bacterium? No, it is an infection caused by bacterium. An abscess, that is usually a bacterium which has caused an infection and then the accumulation of pus. And these are dead white blood cells and digestive tissue, and also dead and living bacteria. And it can be oftentimes through Streptococci, it can be through fungals, and it can be also amoebias by liver abscesses. It can be at the armpits, the breasts, the groin, the gum, liver, brain. And if at the skin, they can have redness and swelling, and some are hurting, others not. And there are antibiotics and antifungal injections and hemoptysis, and they can cause so much damage that they can injure an internal organ and then cause death even. And they are reaching the skin through a wound and through the bloodstream and an internal organ. And they can be surgically drained. Sometimes they are bursting and draining spontaneously, and after draining there can be permanently a tube in it to drain it continuously. And that is according to the Illustrated Medical Dictionary book by Sue Davidson, Penny Press, and Francis Williams on the pages 5 and 6. But this is no substitute for medical knowledge, it's also no medical advice. So what did we all forgot? But it was not bad. The fever, sweating, this part. But that's just one thing. I thought I forgot for half. I'm going to stop again now. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will continue with medicine. If you stay here and participate in the squat training, this will on one leg, the mushroom, and the waving mushroom, the greeting mushroom, not the waving mushroom, our leg, and the greeting mushroom, and the waving. Take the leg at the ankle, make a straight back, change. One leg to the side, the toes are pointing in front, and we're stretching the inner side of the leg. The train stop. Change. And now the mentis go from side to side. And now to the lunges, to the squats. Legs wide apart, and we're doing 12. Number 1, and 2, and 3, and 4, 5, and we're having a half of 6, and 7, and 8, 9, and 10, and now the last two, 11, and 12. And now the 6-pack squat squeeze. The quarter squat, and press against the top part of the leg. And on the other side. Half squat and press again. And on the other side. 3/4 squat, press close to the knee. Other side. Up again. And now the fastest giraffe of the water pond. 3/4 squat, press against the leg. Go towards it. Change. Press. Go towards it. Press. Go towards it. Press. Go towards it. One more round. And up. And the last exercise is the propeller. Full squat. Arms to the sides, over to one leg. Press against the leg. Look up to one end. Middle. Over. Press again. Look up to the end. Middle. And again, a bit stretching, one leg onto the ground, pull the toes in. Foot to the left, pull in. To the right, pull in. Middle, move from left to right. Other heel onto the ground, pull the toes in. To the right, pull in. Left, pull in. Middle, move from left to right. One leg again up. The other one. Take the leg to the ankle. Tuck the tailbone in. Change. Legs to the sides, breathing along. And breathe out. In and up. And out. Breathe in and close the legs. And in and out. And it was my squat training. I thank you very much and next time.